Saturday morning coffee talk with your resident vestibular physical therapist, Amy here. I was thinking today we could talk about how dizziness is similar to pain, at least conceptually. One thing is for sure about dizziness, that is, people who have dizziness have a lot of trouble describing it. Medical practitioners have difficulty asking all the right questions to learn about someone's dizziness. If you think about it, dizziness is just a sensation. It's a sensation that your body has produced. It's a sensation of movement that doesn't match the situation. And it can vary a lot person to person and situation to situation. In a lot of ways, it's very similar to pain. Pain is a sensation of discomfort that is very dependent on what's physiologically going wrong with the body and that person's personality. Like your state of anxiety, your personality in general can actually dictate how much or less pain that you feel. We have a lot of research on this. And for some reason, patients are really good at describing their pain, and practitioners are really good at asking about pain, but it's not the same for dizziness. So why is that? Well, for one thing, us practitioners, we don't really get taught how to investigate dizziness like we're taught how to investigate pain. I mean, we spend semesters learning how to understand pain, learning how to ask about pain, learning how to be empathetic towards pain, and there's tons of research out there on pain. We are really good about asking all the right questions. When did it start? What caused it? What does it feel like? Where do you feel it? When does it come on versus when does it go away? We are not so good, though, at when a patient says, I feel dizzy, believing them, first of all, and then asking all the right questions to get them to tell us exactly what this dizziness feels like, when it comes on, etc., etc. But you can actually take the same track as we do for pain when it comes to dizziness. In school, they teach us to always ask, the basic questions, which is, when did it start? Did something tip it off? Did you have any kind of trauma? Do you know what may have caused it? When does it come on? What kind of activities bring it on? What kind of activities make it go away or make it improve? How bad is it? How severe is it? How bad is it at its worst? How bad is it at its best? And how bad is it right now? And describe exactly what it feels like. So to all my practitioners out there, I would recommend that you use that same line of questioning for dizziness. So if you're a practitioner out there, treat it like pain. Ask all the same questions, but relay it back to their dizziness, and that'll give you a lot of good subjective information to go by.